If you're planning retirement and want to avoid costly mistakes that most retirees make, subscribe, because this channel focuses only on simple, real retirement advice. Are you still working past 65? Maybe you thought you had everything figured out for your health coverage and retirement. Maybe you thought, I will just keep working and Medicare will take care of the rest. But the truth is, there are some mistakes people make with Medicare that can cost you a lot of money. Today, I am going to explain 4 big Medicare mistakes you can't afford to make if you are still working past 65. And don't worry, we'll keep it simple so you can understand it easily. First, let's talk about why this matters. Medicare is the United States government health insurance program for people 65 and older. Even if you are still working, you need to understand how Medicare works. Many people assume that because they have health insurance through their job, Medicare is not important yet. But that is a dangerous assumption. If you delay or make the wrong choice, you could face late enrollment penalties. These penalties can last for the rest of your life, and trust me, nobody wants that. Mistake number 1 is thinking that your employer health insurance automatically protects you from Medicare penalties. Some people think, I am still working, so I don't need Medicare right now. This can be true sometimes, but it is not always the case. If your employer has 20 or more employees, your insurance might cover you, and you can delay Part B without a penalty. But if your employer has less than 20 employees, your insurance may not be enough. Medicare might be primary, meaning it pays first and your employer insurance pays second. If you ignore this, you could end up paying thousands of dollars out of pocket. Even if your employer insurance is good, you must understand when to sign up for Medicare Part A and Part B. Part A is hospital insurance, and most people don't pay for it if they or their spouse worked and paid Medicare taxes. Part B covers doctor's visits and outpatient care, and it has a monthly premium. Missing the sign-up window for Part B can result in a permanent penalty of 10% for every year you delay. So even if you are working and your job insurance seems enough, you need to check the rules carefully. Mistake number 2 is assuming that Medicare covers everything. This is a common mistake. Medicare does not cover all medical costs. It does not cover dental, vision, hearing aids, or long-term care. Some people think, I am paying for Medicare, so I don't need extra insurance. That is wrong. If you ignore gaps in coverage, you could face very high medical bills. For example, a hospital stay can cost tens of thousands of dollars, and if you need surgery or specialized care, Medicare alone might not be enough. Many people also don't realize that Medicare Part A and Part B have deductibles and coinsurance. A deductible is what you pay before Medicare starts paying, and coinsurance is a percentage of costs you must pay even after Medicare pays its share. These amounts can add up fast. If you are still working, it can be tempting to rely only on your employer insurance and skip supplemental coverage. But a Medigap plan or Medicare Advantage plan could save you a lot of money if you get sick or need medical treatment. Don't make the mistake of thinking you are fully protected with just Medicare. Mistake number 3 is not understanding the timing for Medicare enrollment. Timing is everything with Medicare. You get a 7-month initial enrollment period, 3 months before your 65th birthday, your birthday month, and 3 months after. If you are still working, you may qualify for a special enrollment period when you retire or lose employer insurance, but you must act quickly. Waiting too long means paying late enrollment penalties. Here's an example. Imagine you turn 65 and are still working. Your company insurance is good, so you decide to wait to enroll in Medicare Part B. If your company has 20 or more employees, you can delay without penalty. But what if you retire early or your company reduces your coverage? You might only have 8 months to sign up after losing coverage. Miss that window and you could pay a permanent penalty, even if it is a small monthly amount. Over 10 or 20 years, that can be a lot of money. Timing is critical. Mistake number 4 is not reviewing your Medicare coverage every year. Medicare is not set and forget. Every year, Medicare changes costs, premiums, and benefits. Medicare Advantage plans can change networks, and formularies can change. Your health needs might change too. Many people enroll in a plan and never look at it again. This can lead to higher costs or gaps in coverage. It is very important to review your coverage during the Medicare open enrollment period, which is on October 15th to December 7th each year. During this time, you can switch plans, add prescription coverage, or join a Medicare Advantage plan. If you skip this, you may end up paying more or losing coverage for drugs you need. This is especially important if you are still working and your employer insurance is changing. Let's talk a little more about Part D. Part D covers prescription drugs, but it is optional. Many people make the mistake of skipping it while working. That seems fine if your employer plan has good drug coverage, but if your employer plan changes or ends, you need Part D to avoid penalties. Late enrollment penalties for Part D are 1% of the national base premium for every month you delay. Over several years, this can be hundreds of dollars extra each month. Another thing people often miss is how Medicare works with retirement accounts. Some people think, I will keep saving in my 401k or pension and Medicare will cover my health care. But remember, healthcare costs are one of the biggest expenses in retirement. If you make mistakes with Medicare, you could spend more than you saved. It is important to plan your retirement savings with Medicare costs in mind. Many people also forget about employer retiree benefits. Some companies offer retiree health insurance, which can work with Medicare, but you have to know the rules. Some plans require you to enroll in Medicare when eligible. Others coordinate with Medicare differently. If you ignore this, you could lose retiree coverage or pay unnecessary premiums. Here's a tip. Always talk to your Human Resources Department or Benefits Administrator. Ask specific questions. Does our insurance work with Medicare? When should I enroll in Part B? What happens when I retire? Keep notes of their answers. This simple step can prevent big mistakes and costs later. It is also important to understand that Medicare is not free. While Part A might be premium-free, Part B and Part D have monthly premiums. These can increase each year, and if you are still working and making a good income, you may pay higher premiums. This is called the Income-Related Monthly Adjustment Amount, or IRMA. It applies to people with higher income, and it can be hundreds of extra dollars each month. Many people are surprised when they see these costs. Another common mistake is not comparing Medicare Advantage plans with Original Medicare plus Medigap. Medicare Advantage plans often have lower premiums but higher out-of-pocket costs. Original Medicare with Medigap can be more expensive monthly but protects against large unexpected bills. Your choice depends on your health, budget, and how often you go to doctors. Do not assume one option is automatically better than the other. Compare plans carefully. We also need to talk about prescription drugs again. Some plans only cover certain pharmacies or require you to use generic drugs. If your plan changes and you don't check, you may end up paying full price for your medications. Many people take multiple prescriptions, and this mistake can cost hundreds or even thousands each year. Some people also make the mistake of thinking they can rely on employer retiree insurance. Some retiree plans coordinate with Medicare, but others do not. If your plan stops at age 65 or only covers partial costs, you will need Medicare to fill the gap. Check this carefully before you retire. Another mistake is not planning for long-term care. Medicare does not cover long-term care in a nursing home or assisted living. Many people assume Medicare will pay, and they do not plan. Long-term care can cost thousands each month, and if you don't plan, it can quickly drain retirement savings. Consider long-term care insurance or other strategies to protect yourself. It is also important to update your personal information with Medicare. If you move or your income changes, update your details. Missing mail or not reporting changes can cause delays, penalties, or missed benefits. Keep your Medicare card and all letters in a safe place. Many people also forget about preventive services. Medicare covers many preventive services for free, like vaccines, screenings, and checkups.
Using these services can prevent serious illnesses and save money in the long run. Don't skip them thinking your employer insurance covers everything. If you are still working past 65, your job can be your safety net, but relying only on your employer insurance is risky. Know the rules, know the timelines, and understand the gaps. Make sure you enroll in Medicare when necessary and review your plans every year. Small mistakes today can cost big money tomorrow. Finally, don't be afraid to ask for help. Medicare can be confusing and rules change often. There are resources and experts who can help you understand your options and avoid mistakes. Getting advice from someone who knows Medicare can save you thousands and give you peace of mind. Remember, the goal is to enjoy your retirement without worrying about medical bills. If you make these